America. This is WRMI, Okeechobee, Florida. Radio Miami International. You can find out more about WRMI at our website, WRMI.net. That's WRMI.net. Visit our website and share your QSL reports. This is WRMI, Okeechobee, Florida.
Radio Slovakia International. Slovakia Today.
This is Ben Pasco with your news headlines for Wednesday, the 13th of November, 2024.
This is RSI News.
Slovakia co-organizing conference on NATO resilience for the first time. Minister of Health presents areas of proposals for measures to improve healthcare. Košice police officer charged with manslaughter. Prime Minister Robert Fico and Interior Minister Mateusz Esztok on Tuesday launched the 2024 NATO Resilience Symposium in Bratislava. The conference, which is being co-organized by Slovakia for the first time, will focus on topics such as combating cyber attacks, hybrid threats, terrorism, and lone wolves, the Interior Minister explained. In addition, the symposium will focus on protecting logistics and transport, protecting and providing medical assistance, and protecting and providing energy supplies during a war. According to Esztok, Slovakia is a member partner of the EU and NATO that meets its commitments. At the opening of the event, NATO Secretary General Mark Rutte addressed the participants via video and praised Slovakia for keeping to its pledge to invest 2% of GDP in defense. The Resilience Symposium is a strategic political military event co-organized by the NATO Allied Command Transformation in Norfolk, Virginia, and the Defense Planning Division of NATO International Staff in Brussels, together with a host country every year, always in a NATO member country. The resilience of the critical civilian infrastructure is an important part of the NATO agenda, stated the Interior Ministry. The event is set to last until Wednesday. Health Minister Kamil Sasko presented to the representatives of the healthcare sector in Trnava region proposals for more than 30 specific measures to improve the Slovak health sector in 6 areas. The main topic of the meeting were, for example, the staffing situation in the region, the need to train health professionals, and the availability of healthcare. Sasko outlined the proposed measures. The first area is the standardization of payments for medical services. The second one is the optimization of costs for healthcare providers. The third area is the standardization of the conditions of healthcare provision. The fourth one is the financing of the system. The fifth is the reduction of the administrative burden and digitization. And the last one, and today's discussion, by the way, has also confirmed this absolutely unequivocally, is the management of human resources across the sector, added the minister. The aim of the measures, according to him, is and must be the patient in each region. He stated that the staffing situation in the regions was the central topic of the meeting. On Tuesday, the minister also met with Doctors Union to discuss the first item of the 2022 memorandum concerning the financing of hospitals, and agreed that a working group needs to be formed to address the issues. The Doctors Union head, Peter Wisolajski, reported after meeting the minister. The doctors haven't withdrawn their notices yet, and insist on having the government deal with the problems in the health sector. It's crucial for us to fix this, so that it's clear what the insurers actually pay hospitals for. We want to have standardized contracts between hospitals and insurers and be able to check them, because that enables also checking the efficiency of hospitals. If you have a contract that's checkable, comparable between hospitals, it's easy to ascertain which hospital met its commitments, performed as many surgeries, and treated as many patients as promised, and which hospitals didn't. So on our behalf, we insist on having standardized contracts that will be transparent and public. Explain.